Hello, I'm Matthew Gavidia. Today in the MJH Life Sciences Medical World News, the American Journal of Managed Care is pleased to welcome Dr. Susan Millard, pediatrician and the co-author of a list of 5 recommendations that physicians and patients should question on pediatric pulmonology and sleep in children as part of the Choosing Wisely campaign. Great to have you on, Susan. Can you just introduce yourself and tell us a little bit about your work?
Thank you, Matthew. I'm a pediatric pulmonologist at Helen DeVos Children's Hospital in Grand Rapids, Michigan, and an associate professor of pediatrics at Michigan State University. I also am the section chief of our pediatric pulmonary and sleep medicine group here at the Children's Hospital.
And to start us off, can you speak on the Choosing Wisely initiative? What goals are being targeted through this campaign?
So the Choosing Wisely campaign was started by the American Board of Internal Medicine, and many partners in the United States of America are part of it to help patients, families, and medical providers, physicians, nurse practitioners, and physician assistants understand what is the best type of medicine to provide, as opposed to just willy-nilly going through what used to be rote practice and not have thought and consequences for people.
What warranted the need to better educate physicians and patients on pulmonology and sleep-related aspects in pediatrics?
Well, many parts of the American Academy of Pediatric have worked with Choosing Wisely, including groups like neonatology, the hospitalists. There are societies for otolaryngology, many different partners in all aspects of medicine. And the goal is really to help people with specific topics so that physicians and the advanced practice providers can figure out what's safest and best and cost efficient for patients and families.
In one of the 5 recommendations listed by the Choosing Wisely campaign, it was noted that pediatric sleep studies should be performed and interpreted according to pediatric standards and not adult. Is this a prevalent issue, and how can parents ensure that their child is properly assessed for these sleep studies?
Yes, that's a great question. Unfortunately, there are many sleep labs that are out there that advertise for anyone to go to them, but pediatric patients are definitely a specific group. It's not just kids that snore. We're seeing an increased risk of obesity. We're seeing children that might have other medical problems like congenital heart disease, patients with Down syndrome that really need special care and are not appropriate for centers that don't focus in pediatrics. One of the big problems is that people understandably want to go to the closest place, but don't investigate. Some sleep studies they'll do it on a 5-year-old patient and it'll get performed, but they don't do end-tidal CO2 monitoring, which is part of the pediatric recommendations for sleep studies. They might not analyze the results as thoroughly as a pediatric focused sleep doctor would. Sometimes things like shallow breathing called hypopnea can be difficult to analyze, and they could miss those. Also, adult criteria for sleep study is more liberal for obstructive sleep apnea than pediatrics. And the developing brain really develops through early college years. So it's very important to be safe and somewhat conservative in how we're diagnosing sleep apnea so that we're not affecting a child's development and ability to be a productive adult. So it's very important. We have patients that come from farther away that bring a sleep study from a local lab, and the parents are upset when they have to have a second sleep study. The other problem is some of the adult labs will diagnose sleep apnea in a pediatric patient, but then not manage it. And that's a problem too, because then they want us to manage it, but we need to have a study that's appropriate for that patient. So it's duplication of services.